Now, let's talk about the uses of Etodolac-Capsaicin-Me-Sal-Men Kit, liquid and tablet. Etodolac is used to relieve pain from various conditions and reduce pain, swelling, and joint stiffness from arthritis. This medication is known as a nonsteroidal anti-inflammatory drug, NSAID, and works by blocking your body's production of certain natural substances that cause inflammation. If you are treating a chronic condition such as arthritis, it's important to consult your doctor about non-drug treatments and/or using other medications to treat your pain. It is recommended to take this medication as prescribed by your doctor and to discuss with them the best time to take it and any concerns you may have about the dosage. Before starting the medication, make sure to read the medication guide provided by your pharmacist. Take the medication by mouth as directed by your doctor, usually 2 to 4 times a day, with a full glass of water. Avoid lying down for at least 10 minutes after taking it. If you experience stomach upset, take it with food, milk, or an antacid. The dosage will depend on your medical condition and response to treatment. To reduce the risk of side effects, take it at the lowest effective dose for the shortest possible time. Do not increase your dose without consulting your doctor. For certain conditions, like arthritis, it may take up to 2 weeks of regular usage to get the full benefit. If you are taking it as needed, remember that pain medications work best if used at the first signs of pain. If your condition worsens, inform your doctor. You may experience upset stomach, nausea, diarrhea, gas, weakness, drowsiness, dizziness, or blurred vision. If these effects persist or worsen, notify your doctor or pharmacist promptly. This medication may increase your blood pressure, so it's important to monitor it regularly and inform your doctor if it's high. Be sure to contact your doctor immediately if you experience any serious side effects, such as changes in hearing, mental/mood changes, easy bleeding/bruising, difficulty swallowing, symptoms of heart failure, signs of kidney problems, unexplained stiff neck, or symptoms of liver damage. While rare, a serious allergic reaction to this drug can occur. Seek medical help right away if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you experience any other effects not listed here. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Nonsteroidal anti-inflammatory drugs, like Etodolac, may increase the risk of heart attack or stroke, especially if taken for a long time. This risk may be higher for older adults or those with heart disease, high blood pressure, or diabetes. Avoid taking this drug before or after heart bypass surgery. It's also important to be aware that this drug may cause serious bleeding from the stomach or intestines, especially for older adults. If you experience severe stomach pain, black/tarry stools, or vomiting that looks like coffee grounds, seek medical help immediately. Other serious side effects to look out for include chest pain, shortness of breath, weakness on one side of the body, or sudden vision changes. Be sure to discuss the benefits and risks of taking this drug with your doctor or pharmacist. And as always, follow their instructions on the proper dosage and timing for this medication. Before taking Etodolac, make sure to inform your doctor or pharmacist if you have any allergies, especially to aspirin or other NSAIDs. Also, let them know about your medical history, including any conditions like asthma, heart disease, high blood pressure, or liver disease. It's important to stay hydrated while taking this medication to prevent kidney problems, and be cautious about the use of alcohol, tobacco, and marijuana, as they can increase the risk of stomach bleeding. This medication can also make you more sensitive to the sun, so make sure to use sunscreen and protective clothing when outdoors. If you are a woman of childbearing age, discuss the benefits and risks of this medication with your doctor, and if you are pregnant or breastfeeding, consult your doctor before using it. And before any surgical procedures, inform your doctor or dentist about all the medications you are taking. Older adults should be especially cautious when using this medication, as they may be at greater risk for certain complications. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include aliskiren, ACE inhibitors, angiotensin II receptor blockers, cidofovir, corticosteroids, lithium, methotrexate, and water pills, diuretics such as furosemide. This medication may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers similar to Etodolac, which may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you use this drug. If someone has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, slow or shallow breathing, and extreme drowsiness. It's important not to share this medication with others. Your doctor may want to conduct lab and/or medical tests while you are using this medication, such as a complete blood count, liver/kidney function, and blood pressure. It's important to keep all medical and lab appointments. You may also consider making lifestyle changes, such as weight loss if needed, and strengthening/conditioning exercises, to help improve your flexibility and joint function. Be sure to consult your doctor for specific instructions. If you are taking this medication regularly and you happen to miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, just skip the missed dose and take the next one at your regular scheduled time. Do not take a double dose to make up for the missed one. It's important to store Etodolac-Capsaicin-Me-Sal-Men Kit, liquid and tablet at room temperature, away from light and moisture. Make sure to keep them out of the bathroom and out of reach of children and pets. When you no longer need the medication or it has expired, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.